Hello, and welcome to the Introduction to the CoC Annual Performance Report, APR, and ESG Consolidated Annual Performance and Evaluation Report, CAPER training. The purpose of today's presentation is to describe the rationale behind the client data sections of the APR and CAPER, to understand how to use SAGE to submit client-level data to complete the APR and CAPER, and to highlight additional resources available to help recipients with their APR and CAPER submissions. This training is for CoC staff and collaborative applicants, CoC program recipients, and ESG program recipients and subrecipients. But this training may also be of benefit to HMIS leads and system admins, as well as HMIS vendors. It's important to note that this training is a prerequisite to the Using APR and CAPER Data and Strategies to Improve Data Quality on your APR and CAPER training course. This training will provide a description of the APR and CAPER, as well as a detailed description of HUD's data collection expectations. We will also discuss how to submit, correct, and update the reports. At the end of this training, we will point you to additional APR and CAPER resources and trainings. The APR and CAPER are annual reports that focus on project performance. They are submitted to the U.S. Department of Housing and Urban Development within 90 days of the end of a recipient's operating year. These reports are often used to measure and compare project performance and help CoCs and collaborative applicants identify the impacts of projects on overall system performance. The APR and CAPER should be formatted as a comma-separated value or CSV formatted zip file. To submit these reports, you will export this file from your Homeless Management Information System, or HMIS, or a comparable database if you are a victim services provider. Once you've exported your CSV file, you will upload it into SAGE, HUD's HMIS repository. It's important to remember that only the HMIS data for the ESG CAPER and not the entire CAPER is submitted through SAGE. Additional ESG CAPER submission requirements exist in the Econ Planning Suite in IDIS, but we will not be discussing those requirements in this training. Please note that the ESG CAPER SAGE submission replaces CR65 in the Econ Planning Suite. Now we will walk through the different sections of the APR and CAPER. We will not go through every section, so please be aware that you will need to complete sections that are not included in this training. We recommend following all of the instructions provided in the CoC and ESG program guidebooks to ensure successful reporting. Before we dive in, let's go through some key terms. The first is chronically homeless individual. A chronically homeless individual is a person who is homeless, disabled, and has been homeless for at least 1 year or has had at least 4 separate occasions of homelessness within the last 3 years, where the occasions add up to 12 months or more. A leaver is a person who exits the program and is not active on the last day of the operating year. A stayer is a person who is still enrolled in the program on the last day of the operating year. An adult is defined as a person age 18 or older, and a child is defined as a person under the age of 18. Youth is defined as a person between the ages of 12 and 24 who is not in a household with anyone older than 24. A household without children is a household that is composed of only adults, while a household with children and adults is a household composed of at least 1 adult and 1 child. A household with only children is a household composed of only children. An unknown household type is a household that cannot be classified in cases where 1 or more persons are missing dates of birth. However, when the household already have at least 1 known adult and 1 known child, the household type will be categorized as household with children and adults. Now that you are familiar with the key terms used in the APR and CAPER, let's turn to the different questions. Questions 4, 5, and 6 are required for both the APR and CAPER. Question 4 is the project descriptor information. This data comes from the project identifiers in HMIS, including the correct organization name, organization ID, project name, project ID, HMIS project type, and relational projects. Question 5 is the summary counts of people for validation rules. These counts will be used throughout the report to validate the reported totals. For example, the total number of persons served in question 7 must match validation number 1, the total number of persons served. The validation table reports on the total number of persons by category for the period the report is generated for. Question 6 asks about the data quality of the submitted data. This corresponds to the HMIS data quality report programmed into the HMIS. Each section of the data quality report must have a details mode output for users to identify the specific records included in the section which are generating errors. All CoC projects are encouraged to run this data report monthly and correct errors. Data quality is correctable if caught in a timely fashion when the recipient may still have access to the client. Questions 7, 8, and 9 cover the persons and households served as well as contacts and engagements. These questions, with the exception of question 7b, which is APR only, are required for both the APR and the CAPER. These questions are validated against question 5. Questions 7 and 8 focus on whole year versus point-in-time count comparison data from the last Wednesday of January, April, July, and October of the project's operating year. Question 9 reports on street outreach contacts and engagements for supportive service only, street outreach, and emergency shelter projects. Questions 10, 11, and 12 report the demographics of the program participants served. All questions, with the exception of question 10D, which is only required for the CAPER, are required for both the APR and the CAPER. All totals must match the data reported in question 5. It's important to know that any program participants with an unknown household type or unknown demographics will be reported in the unknown category. Even if only one of these data points is missing, then the other cannot be shared outside of the unknown category. Recipients are encouraged to check data quality at regular intervals because of its importance. Questions 13 and 14 are required for APRs and CAPERs, except for questions 13A2, B2, and C2, which are only reported through the APR. Question 13 reports the physical and mental health conditions of program participants, and question 14 reports information on a program participant's history with domestic violence. For question 13, only a person with a definitive yes for HMIS data elements 4.5 to 4.10 will be counted in the count of persons with conditions. For question 14, 14A reports on all adults and heads of households who indicated they were a survivor of domestic violence, while 14B reports on the number of persons fleeing domestic violence at the time of project entry. Please note that both questions are based on the report by the client at their last project stay of the reporting period, if they had multiple entries. Children in households of adult survivors are not reported. Question 15 is required for both the APR and CAPER. It focuses on the living situation of the program participant immediately prior to entering the project and corresponds to the data element 3.917 in the HMIS data standards. Totals for this question must match the totals reported in question 5. Questions 16, 17, 18, and 19 focus on cash income and are only required for the APR. These questions report information collected on the sources, amounts, and changes over time in income for all adults served. This data is usually collected at project entry, during annual assessments, and at project exit. As always, data quality is vital to accurately reporting information. Questions 20 and 21 focus on non-cash benefits and health insurance for all adults served. All questions are required for the APR and CAPER, except question 20B, which is only for the APR. For question 20B, it is important to remember that a stayer who hasn't been in the program for a full year will be counted as data not collected because the program participant hasn't yet had an annual assessment. This is not a data quality issue and will be updated in the next APR if the program participant is still in the program and has had an annual assessment. Question 22 reports the length of participation for program participants. This question only reports the latest project stay, and the totals must match the totals reported in question 5. The APR requires completing questions 22A1, B, and C, while the CAPER requires completing questions 22A2, C, and D. Participation accounts for all the days a person was in the project, even if some of those days occurred prior to the reporting period. The leavers column reports on the days from intake to the date of exit, while the stayers column reports the days from intake until the last day of the reporting period. Question 23 reports the destination of program participants who have exited the program. Which questions are required depends on whether or not you are completing the APR or CAPER and what program component you are reporting for. Please see the red box in the upper right corner of the screen for which questions are required for which report. It's important to remember that the destination types reported here are the same ones reported for the system performance measures. Question 24 reports data from each client's latest project stay, reporting the distinct counts of clients by housing assessment recorded at exit by subsidy information for each assessment. Questions 25, 26, and 27 focus on veteran, chronically homeless, and youth subpopulations served through these programs. For question 25, if no veterans were served, then the table cells may be reported as either blank or 0. For question 25, tables are calculated the same way as all client tables and are filtered to only report on those persons who are identified in HMIS as veterans. For question 26, projects that report at least one chronically homeless person served during the reporting period will have the following tables calculated. If no chronically homeless persons were served, the table cells may be reported as either blank or 0. Chronically homeless persons are calculated in the APR based on the chronic homelessness at project entry method in the HMIS Standard Reporting Terminology Glossary. For question 27, the youth subsections reports on persons from age 12 up to age 24, provided that there is not anyone in the household who is 25 or older. If no youth were served in the table cells, the table cells will be reported as either blank or 0. All tables are calculated the same way as the all client tables, but are filtered to only report on those persons who were identified in HMIS as youth at project entry date, or the report start date, whichever is later. Before trying to submit your APR or CAPER, Please try to log into Sage and check to be sure you have access to the right grants at the right time to to submit reports to HUD. As a reminder, APRs and ESG CAPERs are submitted as comma-separated value or CSV files in the Sage HMIS reporting repository. Submitting the CSV files is a little different for CoC program and ESG program recipients, so please be sure to follow the correct directions on the screen for your funding program. Instructions for CSV outputs can be found in the APR and CAPER reporting specifications document. If your HMIS cannot produce the CSV file needed to submit the APR or CAPER, please follow the directions on the screen for requesting an exemption. If you need to correct a CSV file that was previously uploaded, please open a new question in the Sage AAQ Virtual Help Desk on the HUD Exchange. There are many important resources available to help guide you through the APR or CAPER submittal process. These resources are available on the HUD Exchange at the link shown on the screen. Now that you better understand the questions in the APR and CAPER, let's talk about your next steps. First, check with your HMIS admin and learn how to run the APR or CAPER from your HMIS. Second, log into Sage and ensure you have a login and grant info that allows you to report on time. Third, please bookmark the AAQ desk so you can submit questions as needed to HUD. And fourth, please look for more trainings on the APR and CAPER from HUD, including ones on data quality and how to use your APR or CAPER data. Thank you for attending this training.